Welcome back to You Heard It Here with Dr. Gary. Today's video is going to be a real treat. We're going to do an unboxing of the Sony CRE C-10 self-fit hearing device. After the unboxing, we're going to walk you through the app and how to set up this device. Then we're going to do a comparison for this device with traditional prescription hearing aids on an actual patient's ear. We're going to show you how they compare and give our impressions. Please take a minute to like and subscribe. Let's let the unboxing begin.
Let's start the unboxing of the Sony CRE C-10 self-fit hearing aids. Very aesthetically appealing packaging. As we open the box, you're going to see a nice carrying case. This hard carrying case allows you a safe place to keep the hearing aids when they're not in your ears, even if you're out and about. As we open the case here, you're going to see two hearing aids. Yes, they come in sets and they are marked right and left for convenience. This will help you keep them in the right ears and allow them to be more comfortable and more effective. Now, my observation here is looking at the size of the actual units. They're not going to be quite as aesthetically appealing as the picture on the front of the box makes them out to be. However, that is going to depend on the size of your ear canal. So if your ear canal is large enough, they will be pretty discreet. We've got a user guide that includes all instructions and prerequisite information set by the FDA for OTCs. We've got a couple of different fitting sleeves. These different fitting sleeves go on the end of the hearing aid and help to improve comfort based on your ear canal size. Cleaning cloth and cleaning brush, both used to keep the hearing aids free of wax and working better. Some size 10 batteries. Now, you will be needing a lot of size 10 batteries if you're going to use this unit consistently, since size 10 batteries traditionally do not last that long, but given their small size, they allow the unit to be more discreet. As we look at this overall packaging, again, it's a very aesthetically appealing packaging, and I think they did a really nice job putting this together.
Now that we've actually unboxed this device, let's go ahead and open up the app and take a look and see what it takes to get this device set for you to use at home.
Now that we've finished unboxing our Sony CRE C-10 self-fit hearing aids, we're going to take a look at the app and see how we actually connect it and the setup process. First thing you do is obviously establish an account with Sony. If you already have one, log in. Then you're going to select which device you're trying to pair. It is important to note that these hearing aids do connect to the app via Bluetooth. However, they do not have Bluetooth for audio streaming. Some other models may in the future. This particular one does not. So in order to pair this to the app, we utilize the Bluetooth. The app is going to walk you through the instructions, first opening and closing the battery doors. Confirming that your Bluetooth is on is going to be next. And then it's going to have you put the hearing aids in. Obviously, we're starting with the left ear. So once the hearing aid is in the left ear and connects to the app, you're going to hear an audible tone. And once you hear that tone, you have to select whether you heard it or not. Okay, it looks like that left one is paired. Now we're going to do the same thing with the right ear. Again, open and close the battery door. Put the hearing aid in your ear and listen for the tone. Okay, and now it looks like we've got the right connected as well. Once both hearing aids are connected to the app, the next step is to establish a hearing profile. For the hearing profile, you're going to hear a series of beeps, and you have to indicate whether you heard 0, 1, 2, 3, or 4 beeps. It goes through this several times, both on the right and the left. We cut this down a little bit just for shortening up the video. Once you've indicated whether you heard 0, 1, 2, 3, or 4 beeps in each ear, it's then going to apply the hearing profile. Applying the settings right now on the left. Okay, that looks good. And now we're going to do the same thing to the right. We're applying the settings on the right side. Perfect. Once you've applied the settings, the app is then going to ask you to have a conversation with someone, allowing you to turn the volume up and down, adjust it so it's comfortable. In this case, our patient found the hearing aids to be fairly comfortable. We're going to do some measurements in a few minutes via real ear in order to determine exactly how it's working compared to their actual hearing loss. Once you find the volume that's comfortable for you, you then are given the volume control bar on the app, and you're pretty much set up.
Now that we've unboxed this device, we've looked at its beautiful packaging, and we've seen how the app works to get it set up, let's go ahead and put it in a patient's ear and really compare what it looks like when compared to a prescription hearing aid. Now, these hearing devices, these self-fit devices, do not require a hearing test. For the purposes of our comparison, we worked with a patient who allowed us to test their hearing, help them get this device set up, and then was also fit with a set of prescription hearing aids, so we could do a head-to-head comparison. Our real ear measures are actually going to look at the patient's real hearing loss and see how this device set where they like it compares to a set of prescription hearing aids programmed the way us as the audiologist want it set. Let's take a look and see what happens.
Let's take a look at some real ear measures. Real ear measures the output of a hearing aid in the patient's ear canal. The first thing we're going to look at is the Sony OTC hearing product. Then we're going to compare that to a prescriptive hearing aid. What you're seeing on the screen is the target lines. The line that's most important to watch is the middle green line. That's the 60 decibel target gain. This sound is being presented at 60 decibels, and you can see in the mid and high frequencies, the Sony OTC product is underfit. Now we're going to be looking at an actual prescriptive hearing aid. Now this hearing aid has been programmed to this patient's hearing loss and is definitely a little bit better of a fit in this patient's ear. The patient does report sound difference, including a more full-bodied sound with the hearing aid as well as better sharpness and clarity. What we're going to notice is that the output line is going to more closely mirror that middle green 60 decibel gain target gain line, showing better gain in the mid and high frequencies compared to the OTC product.
So now that we've done the unboxing, we've looked at the app and how it functions, and we've compared this particular OTC device, the Sony CRE C-10, to a prescriptive hearing aid. What are my thoughts? What are the impressions? And is this going to be effective for patients? Well, there are good and bad. On the positives, the aesthetics, despite my concerns about how it's going to look in the patient's ear, were great. Especially for a male with a larger ear canal, the aesthetics of that hearing aid were wonderful. It tucked right in and hid very well. On the other hand, when compared to a prescriptive fitting, the hearing aid was well underfit, especially in the mid and high frequencies. Unfortunately, as a person starts with hearing aids, they like the sound softer until they acclimate. But once they acclimate, they want that extra volume. It really does help their brain understand and grasp onto speech, especially in the presence of background noise. So unfortunately, what I see happening with products that work this way is initially, patients are going to be very happy. That's probably going to last 2, 3, 4 months. Then what's going to happen is they're going to want more volume, and it's not going to be there. Now, in full transparency, this patient's hearing is a mild to moderate hearing loss. That really is the upper fitting range for this particular device. In my opinion, it's a good product. It's packaged really well. This is a great partnership between Sony and Signia's parent company. However, I don't think you're going to see a lot of long-term gain from this product. I think patients who start with this, if they stick with hearing aids, are going to be in prescriptive hearing aids within a year. Between the feel, the need for use of batteries, the lack of Bluetooth, and of course, that reduction in mid and high frequency gain, the long-term benefits, I don't know if they justify the cost. If your hearing loss fits within it and you're going to be a part-time or occasional user, this may be the way to go. If it's going to be an all-day, everyday process, like we would encourage you to wear prescriptive hearing aids, this may not be for you. This has been You Heard It Here with Dr. Gary. Please like and subscribe. We'll continue to do more of these reviews as we get our hands on more of these OTC products, because it seems to be all over the hearing healthcare world. What are they? Are they working? And how much is it going to affect everything? Again, this has been You Heard It Here with Dr. Gary. Please like and subscribe. We'll see you in the next video.